Hi, everybody. I'm Leslyn Keith. I'm the Director of Research and President of the Board for the Lipedema Project. And I'm here with you usually on the first and third Thursday, talking about research updates that pertain to lipedema. I had to do a little reschedule because I was off at a meeting last week. I also teach other therapists to be lymphedema lymphatic therapists. And the organization that I work for, Close Training, was having a special meeting of all the instructors. And we were really going over our course and how can we update it, to reflect recent research and stuff like that. And so I was gone when I normally would have done this research update with you. So I'm here today instead. If you are here listening to me, I always love to have you, as Dawn just did, to post and say that you're here listening and where you're from, and Dawn's in Pennsylvania. So go ahead and post something and let me know that you can hear me and that you're interested, and maybe you have some comments and where you're from. I always love to see that. So today, what I was going to do is continue on with what I did, it must have been about 3 weeks ago now, is that I was talking to you about clinical trials on lipedema that you can participate in, because many people have told me that they want to help with research. And some of these clinical trials are actually looking for healthy controls. So even if you are interested in lipedema, but you don't have it yourself, some of these trials you can enroll in to participate in that way as a comparison group. So I'm going to give you some information about 4 more clinical trials. We talked about 4 last time also. So this is kind of part 2. And interestingly, these are clinical trials from around the world. And I have 2 today that are in Norway. So Norway is doing a lot with lipedema. And I have, one is in Cleveland in the USA. And the other one is in Nashville, Tennessee in the USA. So 2 in the USA and 2 in Norway that I wanted to tell you about today. So let's get started. The first one I'm going to tell you about is the effects of endurance training in women with lipedema. And we will post in here the link to go to get more information about this clinical trial, but I'm going to give you some information about it and see if this is something that maybe you would like to participate in. So this is, as I was saying before, it's happening in Norway, in Trondheim, Norway, at the Norwegian University of Science and Technology. And the purpose of this study is to determine the potential therapeutic effects of high-intensity interval training. Some of you may have heard of this. It's called HIIT training, HIIT. And they want to know what are the effects of doing this on pain, quality of life, and body composition, cardio fitness, all blood biomarkers, all these kind of things. What's the effect that it has on that for women with lipedema? So what they're going to do, the intervention is going to be that participants are going to, in the intervention group, are going to go have 8 weeks of supervised high-intensity interval training or HIIT training, as well as they're going to be performing some exercises also on their own once a week for the duration of the study, which is 8 weeks. And the control group will also be have lipedema, but they are just going to do normal activities. They're not going to do any special exercises. And I wanted to point out that this trial, as well as actually all of the trials I'm going to tell you about today, and the ones I talked about last week or 3 weeks ago, are what they call asynchronous interventions, meaning that you have to sign up by a certain date, and then you do all of the intervention as a group. So they are just doing during the course of the several years while they're conducting the clinical trial, they're recruiting people. And then once you have been shown to be eligible to participate, then they're plugging you into a particular intervention. And you're just doing that on your own. You're coming in to get assessed and measured and filling out forms, stuff like that, on your own. So there's no particular date you have to start. It's just that you have to have completed the intervention by the time that the study officially closes and it's done. And I'm going to give you those dates so you know that, if you have enough time to join up. So this one happening in Norway. And so they're testing that HIT training on lipedema. And so here's the assessments they're going to be doing. They're going to have you fill out several self-report surveys on what's your pain, what's your health status, what's your current quality of life. They're also going to be doing blood draws, and they're going to do various measures of your weight, your body composition, and other metabolism checks, stuff like that. So they're going to do those various things before you do the intervention, then you would do the intervention, and then they would retest you again. So in order to participate, here are some of the eligibility requirements. You need to be between 18 and 65 years. You have to be female or biological female. You have to have a diagnosis of lipedema, and you have to be able to meet for that supervised exercise training in Trondheim, Norway. So you got to be able to be in Norway for the duration of the study. And some of the things that would exclude you from the study, and I didn't list everything, but two major things that would exclude you is if you have an eating disorder, and also if you have some kind of orthopedic limitation that would not allow you to participate in the high intensity exercise. So, and again, we have a link there if you want to follow that link and find out more information about that study. So the next clinical trial I wanted to tell you about, this one also in Norway, surgical treatment of lipedema in Norway, a national multi-center study. And this one is big. And like I say, Norway is really doing some wonderful things on lipedema. And this one, it's going to be in Bergen, Norway, but also at several other hospitals in Norway as well. But the main center is in Bergen. And it lists some other Norwegian cities. If you are in Norway or will be in Norway, you can follow the link that we're going to give you, and then you can see if all those other cities are accessible to you. But this is what's exciting, is that the Ministry of Health and Care Services in Norway found that the scientific documentation for the effects of liposuction be insufficient, and has recommended that surgical treatment of lipedema be evaluated through a 5-year clinical trial. That is just fabulous. I mean, I think we'll get some great information from this. And so this multinational study, multi-center study, will compare liposuction and various treatment regimes over 5 years. So the intervention is that they're going to have people randomized into 2 different conservative treatment groups. One is going to have either standard conservative treatment, which is CDT, manual lymph drainage, skin care, compression therapy, and then the other one is going to be that standard treatment plus using a pneumatic pump. So then after you've done that for 6 months, and again, remember, this is asynchronous, so everybody doesn't have to start at the same time doing your conservative treatment. But after you've done that treatment, and 6 months later, then you're going to be then randomized again into 2 groups. And if you still want surgery, still want liposuction after doing that conservative treatment, whatever it was, then you're going to be randomized into 2 more groups. And so then you're either going to be in what they call an early surgery or a late surgery. So I'm going to further describe those groups, because it ends up being 4 different groups at one point. So you have the conservative therapy group, that's physical therapy, including exercise, compression therapy, manual lymph drainage, and you're given a self-care program, plus individual counseling from a dietitian. Very interesting. And then remember, you have the conservative therapy plus a pump. So whatever you sign up for this trial, then if it's, oh, we're now looking for someone to be standard therapy plus pump, you automatically would be put there. Oh, it's time for someone to go into this, just the standard therapy group. So they're randomized people just by whenever you show up and you've been deemed eligible and you complete all your paperwork, then they plug you into one of those two groups. Complete that 6 months later, now you're going to randomize again into another group if you still want liposuction. Of course, you don't have to have liposuction, but if you decide you still want it, you're going to have the early liposuction group will be within 6 to 9 months of inclusion of the study. So it's almost like you finish your conservative therapy, and then if you're in the early group, boom, you go immediately into liposuction. The other one is the late liposuction group. And that one, it will be 18 to 21 months from inclusion in the study. So I think there's a lot of interesting things that they're going to find out from the study. And again, that's the length of time that they're going to be having people in it. They're looking for a total of 220 participants, which is a very good number, especially when you're talking about potentially 4 different groups. You really want to have at least 30 people in each group, and they're definitely going to exceed that number if they can get enough people signed up. So if you're in Norway, you have until the study is ending December 31st, 2025. So plan your next vacation and spend a good chunk of time in Norway to participate. And so in order to participate, you have to be biological female between age 20 and 65. They want you to have significant pain from lipedema. I think that they're finding the most common reason for women getting this type of surgery, wanting to have liposuction, is due to pain, and I hope to have that resolved. So they want you to have significant pain. And then they're really looking for early stage. So they're looking for lipedema stage 1 or 2, and then what they call localized stage 3. So in one portion of your body, I guess, it is considered to be stage 3. I'm not exactly clear on that, but you might be able to follow that link and find out for sure to see if you would qualify. And things that would exclude you from the study is that you need to be fluent in Norwegian. You can't be pregnant. You can't currently have a malignancy or cancer. You can't have previously already done liposuction surgery for your lipedema. You can't be smoking. You can't have a BMI greater than 28. Again, they're really looking for the early stage lipedema. And they don't want you to have any serious comorbidities such as a heart, lung, or kidney disease. I think that is to make sure that you're going to be okay with being able to do surgery if you wish to do it. And lastly, you can't be part of the study if you're not willing to wear compression garments, because that's going to be part of the standard conservative therapy and the conservative therapy with pump. And so in order to fit into one of those two groups, you have to be willing to wear a compression garment. So again, we give you the link and you can find out more information. So now let's come to the US. And I'm going to talk to you about this one that's happening at the Cleveland Clinic in Ohio. And this one is led by Scott Cameron. I'm not familiar with him, but he is the MD, PhD that is the principal investigator for this study. And so this study, it's called the Vascular Lab Resource Biorepository Study. So they're looking at tissue and blood samples and stuff like that. And so so this one doesn't necessarily have an intervention like the last two studies I just talked to you about. This is more of what we call an observational study. So we get lots of data on you, we gather lots of information about you, and then and we see is there an association with other things that might have an impact on lipedema. And so it's observational. It's not testing out an intervention. So what they say the purpose of this is to study biomarkers obtained from collected samples and then correlate them with cardiovascular or metabolic diseases. That's interesting. And they're looking to develop what they call an enduring tool to allow for collaborative research between clinicians at the Cleveland Clinic and basic scientists at the Lerner Research Institute. And this collaboration will allow resources to be available to clinics and basic researchers alike. And they're going to be collecting blood, urine, and or stool samples. And they're going to be getting all kinds of clinical data, information about you and your medical history that's all going to go with your samples in a biorepository. And they're also going to be doing DNA sampling to look at the genetic relationships to lipedema. So very interesting study. They're hoping to get 500 recipients. Again, this could be done at any time until December 31st, 2030. And so you'll have to follow the link on this, because it may be that if you're in the United States and you're able to get to Ohio, it might just be 1 or 2 trips to Ohio for a day or two to participate in this study. So even if you don't live in Ohio, you might still be someone who could participate. So some of the conditions that they're looking at, in addition to lipedema and lymphedema, are going to be include cardiovascular diseases, metabolic diseases, peripheral artery disease, venous disease, thrombosis, May-Thurner syndrome, thoracic outlet syndrome, and I did not name all of them. There's a whole bunch of them they're looking at, but you'll see when you look at that list that several things seem to happen in conjunction with lipedema, and they're trying to see, well, how often do these show up? What impact does it have on the lipedema and the lymphedema? So it's going to be, I think, really something really interesting to participate. Now, this one, in order to be eligible for the study, you just have to be an adult. There's no upper age. So it just says 18 and older. So, and it says actually male or female, because they're also looking at lymphedema and not just lipedema. So you could be biological male or female. And also they would like you to be diagnosed with or at risk for cardiovascular or metabolic diseases. So because they're really looking for to see what kind of associations there are with those two large group of diseases in particular. So I'm not sure how they decide if you're at risk for. So maybe they're looking at family history or stuff like that. So if you're interested, I think it's well worth looking into. And some things that would keep you from being able to participate in this study are if you have a life expectancy of 6 months or less at the time of enrollment. So if you are, have a fatal disease and not expected to live longer than 6 months, you cannot be in the study. You can't be pregnant. You can't have severe anemia. And I'm thinking that's because they're going to be doing a lot of blood draws, which is not going to be safe for someone with anemia. So again, link is in the chat, and you can go to that link and find out more if you'd like to participate in that Vascular Lab Resource Biorepository study being conducted at the Cleveland Clinic in Ohio. And so one more I got for you. This one is happening at Vanderbilt University in Nashville, Tennessee in the USA. And this one is called Visualizing Vascular Mechanisms of Lipedema. And so interestingly, this one, when they got a lot of background about lipedema and stuff, and they were talking about in their purpose, they said lipedema is commonly misdiagnosed as obesity. And so we need to have ways of differentiating between these conditions. And then they also talked about how there are some non-invasive lymphatic imaging strategies that are traditionally underused for lipedema. And so trying to find these things, when you don't have a needle stuck into you, don't have a tissue biopsy, stuff like that, how can we use these tools to help us differentiate between different conditions? And so this study is particularly looking at how can we use these tools to help distinguish lipedema from other conditions. So they have some very interesting hypotheses that they're testing with this. The first one is ultrasound not invasive at all, not painful unless they push really hard. If any of you have ever had where they're looking for a DVT and they're pushing with that ultrasound wand into very deeply to be able to see if you've got a blood clot, that can, if you have lipedema, that can be painful. But normally ultrasound, not so painful. And their hypothesis is that ultrasound can be used as an alternative to MRI for measuring the subcutaneous fat deposition. And in this way, we can distinguish lipedema from obesity. Their second hypothesis about ultrasound is that doing ultrasound measurement of fat deposition along with other bedside tools for measuring the water deposition can have an improved ability over ultrasound alone. So combining it with like bioimpedance or body composition, that it might be useful to use those two non-invasive tools together. And then that would help us distinguish between lipedema and healthy or obesity. And another hypothesis they have, because this group has done quite a bit already by looking at the sodium levels in lipedema, subcutaneous fat. And so this one is looking at that tissue sodium is reduced following CDT. And so they're going to have people undergo CDT or complete decongestive therapy, a non-invasive treatment, and they believe that the tissue sodium would be reduced after having that treatment, and then lead to better outcomes for lipedema. And then their last one is that lymphatic flow, their hypothesis is that lymphatic flow is reduced, arterial blood flow is elevated in the legs of patients with lipedema compared to controls. They think that you'd have decreased, well, let me put it this way, that you have increased flow of blood into your legs, but decreased evacuation through the lymphatics in lipedema. And so they were looking for confirmation or refutation of that hypothesis. So there is some of the stuff in this study is observational, but some stuff is looking at, like I say, what are your outcomes after CDT as far as tissue sodium? So they're going to have these following groups. They're going to have participants with lipedema prior to receiving CDT. And so the requirements to be in that group are that you can be 18 to 80 years old. You can have a BMI of 18 to 40, and you need to be biologically female, and you need to have a diagnosis of lipedema. So that's going to be pre-standard therapy or CDT, and then you're going to have those same participants we're going to be looking at post-CDT, and that is you will be diagnosed with lipedema, biological female, age range 18 to 80, and BMI 18 to 40. So both of those groups, same parameter, but we're looking at one before CDT and one after CDT. And then we're going to have the control group. And so this one is that you'll be biological female, but you will not have a diagnosis of lipedema. So this is one of these that if you're interested in lipedema, maybe you have a loved one who has lipedema, but you can enroll as a healthy control, or in other words, someone who does not have lipedema, and same age and BMI range for that group. And again, remember, this is an asynchronous study, so you can start at any time as long as you are finished with the study by January 1, 2027. So it's quite a bit of time to participate that. They're looking to have a total of 110 participants. That one, I think it gives you plenty of time. And if you're in the United States, you might be able to go there in order to participate. This is in Nashville. So they're going to be doing imaging with MRI. They're going to be doing ultrasound studies. They're also going to be doing blood, urine, and DNA sampling. What I wasn't able to see is that where you had to have your course of CDT if you are going in as a lipedema, someone with lipedema. So you might, if you're not going there as a healthy control, you might have to be in that area in order to go through that course of CDT and have it done at Vanderbilt in Nashville. Let's see. And some things that would exclude you from being in this study is you can't have primary or hereditary lymphedema. You have to, if you cannot go into an MRI machine, you cannot be in the study. If you're pregnant, if you have severe claustrophobia, I think that has to do with the MRI machine. So even if you are, the machine can accommodate you, but it is quite an enclosed space, you would not be able to participate. And you have to be able to give informed consent as you do in any study. You can't have an active infection or an open wound. You can't have, let's see, any cognitive limitations, so you were not able to understand the instructions or adhere to whatever the study protocols are. So I didn't list everything, but again, if you go to that link, you can get more information to see if you can participate in that. And wow, it took me a while to get through those 4 studies. So I'm going to quickly go over just a couple of really cool announcements for you. The first of which I wanted to tell you about the NIH National Heart, Lung, and Blood Institute is one of the institutes of the National Institutes of Health. They just had a meeting this morning where they were announcing, they came out with the results from the lymphatic working group. And this working group suggested that we establish the National Commission on Lymphatic Diseases. And this group, this commission, they're going to be charged with figuring out what do we need to be researching, what do we need to look at, how can we make things better for people with lymphatic diseases, of which lipedema is one. I think this is pretty awesome that's going to be happening, that they will, it might direct funding for research in particular directions. But not only that, this commission is going to be composed of not only researchers and experts and stuff like that, but they're also looking for patient advocates, caregivers, and patients themselves. There is a recording. Well, it just happened this morning. The recording is not available yet, but we will put the link in the chat here, and keep checking so you can watch the recording, because especially if you are interested in maybe serving on this commission, I would highly suggest that you watch that recording. And they tell you, I did not write it down at the time as I was watching this morning, but they do talk about if you're interested in being on the commission, who to contact and stuff like that. So I think this is a huge opportunity for even if you don't want to be in a clinical trial yourself, but you want to lead and encourage the research about lipedema. This is a great way to participate in that. So that is wonderful. I am going to now, I need to look at some other things we got happening. I want to talk about the this Friday, we have our pain clinic coming up. And so we will put in the chat here this Friday at 1:30 p.m. Eastern. We have our pain clinic. If you have lipedema and you're suffering from pain, this is held virtually, and be sure to come. This is with Brian Hayward, our CBD consultant, 1:30 p.m. Eastern this Friday. We also have a wonderful webinar, a free webinar coming up this Sunday. It's called Giving and Receiving: How Community Can Make You a Badass in Your Journey with Lipedema and Lymphedema. And it's a community engagement event that's happening this Sunday, February 12th at 3 p.m. Eastern. So be sure and check that out. And then I also want to talk about our big event that's happening on March 31st, April 1 and 2, a fresh take on lipedema and lymphedema solutions. This is a heart-to-heart collaborative 3-day virtual community event. We're going to be talking about keto and all kinds of interventions to make your life better if you have lipedema and or lymphedema. So that I'll have all these links in there. I'm just going to go through really quick because we are just about out of time. I want to make sure that if we had any other comments, thank you for posting. If you said where you are in the world, and as usual, we have lots of people from Michigan. Oh, and Nadia from Australia, wonderful. Thank you for saying hi and posting on there. I hope this was informative for you. Went a little bit long, sorry about that, but there's always interesting stuff coming up in research for lipedema, which is great. I'm wonderful. One Facebook user says she can't see any other comments in her chat. I'm not sure why, because I'm not very good with technology. But you might, if you go on to the disease they call FAT Facebook group later, you might be able to see the complete thing of the chat. If you're on your phone, especially, go on your computer later, and you might be able to see all that, all the comments and everything. So wonderful to be here with you. And until next time, I'll see you later. Bye.